So this is Medical Equipment in Short Supply and How It Relates to the Facemaker by Ashley. So kind of just an overall short supply history. World War One, they kind of lacked the antiseptics at this point. They did a lot of boiling water and alcohol to kind of sterilize stuff. Bandages, they did a lot of reusing after sterilizing them, which today we know is not the best practice. For anesthesia, they did alcohol, but to not like clean the area, to take the edge off the soldiers a little bit, and they were very selective of who received anesthesia. Surgical tools, they did a lot of improvising and a lot of reusing. World War II, back to bandages, they did a lot of reusing and improvising as well. As you can see in the bottom right-hand corner of the picture, that's lace and tool and everything that they used. Anything that can or looked like it could be used as a bandage, they used. Sutures, they also were used and were improvising as well on that. They were using anything from silk to twine to fishing line. PPE, they also were reusing and improvising, making makeshift masks with gauze. Relevance to today's current practice, year 2020, the one we all know and love. For pictures, I kind of just threw up some COVID memes, some PPE memes, because that'd be better than looking at scary minions with PPE on. We reused a lot. Most of it was not meant to be reused. Gowns, masks, N95s, gloves sometimes were all reused. Ventilators, we were very selective on who was getting a ventilator and how long they were going to be receiving it. Disinfectant wipes and sprays, sedatives, and anesthetics. We were also very selective of who was going to be using those and kind of used a reserved approach. IV bags and tubing, we used more reserved approach to fluid therapy as well. And the classic 2020 supply shortage of toilet paper and paper towels. The relevance also for year 2020 and kind of the tail end of 22. IV bags and fluids were kind of on a reserved approach to the fluid therapy. In tail end of 24, we had that hurricane come through the southern part of the US and it took out the Baxter manufacturing plant in North Carolina and put a hold on the fluids in the bags. Baxter also makes blood pressure cuffs as well in Mexico, and there has been a shortage in the raw material that is used to make blood pressure cuffs. So a lot of hospitals are going to using one cuff per room and making sure that each patient is only using one cuff and making sure that we're properly disinfecting them. PPE, we're still doing a lot of reusing supplies. Infusion pumps, we're asking our other fellow coworkers, hey, is your patient done with the pump? And we're fighting for pumps and searching room to room to room for extra pumps. Ventilators, we're still kind of picky on who's receiving them and who is receiving them for how long. And how it relates to the facemaker. So the bottom right picture, a little foul, I know. So to start with medical tools, there was the quote fire engine that was made, and it was a homemade irrigation system device that helps wash out wounds. That was also kind of to help prevent bacteria from festering in wounds that were just being closed shut kind of immediately. And he talks about how since antiseptics weren't really a thing then, and the doctors weren't really used to using them, they'd still just close them up. So they had to make sure that they were at least washed out a little bit before they close them. They also had the angle, the forceps to help guide the ET tubes into the larynx. Those were created, and those were called the Ameliogus forceps. And he talked about that in the prologue a little bit and how the creation of that happened during World War One and how he was kind of a part of that. With the skinned grafts, Gilly started to use tubed pedicles for soldiers to help kind of bring skin from the abdomen up to their face to help kind of make their appearance a little better when they didn't have skin to start grafting from on their face. It's a little foul looking at pictures of it, looking up what it was. They take skin from like your abdomen, your legs, make it a tube, stitch it along your body, your wrist, your arm, your legs, basically making it a living tube of skin up to your face to make sure it still has the correct blood flow and the right amount of blood flow going up to your face to help kind of suture everything together and make sure everything flows. There are my references. And then just a little quick question. Have you ever had a reused PPE?